Hello and good morning everyone. So now today we will be moving forward to the revision of USMLE Step 1 2021 Microbiology, and we are on Step 1 page 150. I am Dr. Rickettsiae, an infectious disease expert as well as clinical researcher from the Harvard Medical School. So talking about this Rickettsiae disease, we know that Rickettsiae disease and the vector-borne illness, this Rickettsiae are obligate intracellular parasite, obligate intracellular bacteria that causing ranges of diseases. They have different species like Rocky Mountain fever, endemic typhus, epidemic typhus, that is having the rashes mainly. They have common rashes. There are other Rickettsiae disease like ehrlichiosis, anaplasmosis and Q fever. They have the rarely have the rashes. They have but rare. Rash is rare but common in this Rocky Mountain spotted fever and typhus, that is the endemic and epidemic typhus. So since they are the obligate intracellular parasite, obligate intracellular bacteria, so they cannot be cultured outside. So we have to depend upon the molecular and serological test for diagnosis. That is the important, and the clinical picture is the major catch to identify or deal the questions in your USMLE or any entrance exam all over the world. So talking about the Rickettsiae disease, first we'll go through the text, then we'll explain it through the picture, and then again come and revise the same text. So let's go through it. The Rickettsiae disease and vector-borne diseases, these are treatment is doxycycline. You give doxycycline, the drug of choice for all Rickettsiae disease. We have alternative like chloramphenicol, but we need to be careful during the pregnancy about both this drug. So the diseases that has the rash common are Rocky Mountain spotted fever and typhus group. Then Rocky Mountain spotted fever is caused by the Rickettsiae. Typhus, they have two, endemic typhus and epidemic typhus. Endemic typhus is caused by Rickettsiae typhi, and epidemic typhus is caused by Rickettsiae prowazekii. So you have the three species you have to remember the most, that is Rickettsiae typhi and Rickettsiae prowazekii. Rickettsiae will cause the disease known as the Rocky Mountain spotted fever. Rickettsiae typhi will cause by the endemic fever, and the Rickettsiae prowazekii will cause the epidemic typhus, endemic typhus and epidemic typhus. You have to one more thing, typhus should not be confused with the typhoid. Typhoid is caused by Salmonella species, that is Kathmandu is the capital city of typhoid. That is the bacterial, but that is Salmonella that you have to understand. This we are talking about the typhus. There is another scrub typhus disease which is also common in Nepal, but that is caused by Oriental Susugamusi. That is also one of the present in Nepal, but that is less common in USA, so that will be less commonly asked. Talking about this Rocky Mountain fever and typhus, this Rocky Mountain spotted fever, we know they all are the bacterial disease. This is the intracellular bacteria, obligate intracellular bacteria. So they need a vector to get transport to the human. So they cannot survive outside. So how they will come to us? They need somebody that carry that bacteria inside their cell and that they inject into our cell, and then we get infected. So there is need a vector in all the case when they transmit the disease. So what will be the vector? If you are talking about Rocky Mountain spotted fever, the disease bacteria causing is Rickettsiae and the vector is tick. If you are talking about the typhus, that it is caused by Rickettsiae typhi, that vector is rat flea. If you are talking about the epidemic typhus, then that is caused by the Rickettsiae prowazekii and the vector is human body louse. So we know these are the intracellular and they cannot survive outside, so they need somebody. So what is the vector? The vector we have to remember, the bacteria, vector and disease. These three things you have to remember to catch your answer. So let's talk about the Rocky Mountain spotted fever. This is Rickettsiae, vector is tick. This, despite its name, the disease occurs primarily in the South Atlantic state, especially North Carolina. Rash typically start at the wrist and ankles and then spread to the trunk, palm and sole. We can especially remember this classical triad, headache, fever and rash, that's vasculitis, and there is the formula to remember them, that is palm and sole rashes in the Coxsackie A infection, that is hand, foot and mouth disease, Rocky Mountain spotted fever and secondary syphilis. I have shown you that I have discussed this car's formula. You drive your car with the palm and sole. There are only three diseases that will cause rashes on your palm and sole, and that is Coxsackie A, then Coxsackie A, then this is the Rickettsiae, and this is the secondary syphilis. So this is the way to remember. There are only three diseases that cause rashes in your palm and sole. Other diseases have rashes, but they are presently on the body and trunk and limbs only, but they do not present at palm and sole. So these three diseases, that is Coxsackie A, Rocky Mountain spotted fever, and this secondary syphilis. These are usually causing rashes on the palm and sole as well. Okay, so let me take you to the some of the images so you will understand. Normally what we are taking, this is the Rocky Mountain range in the USA. In the America, if you see, this is the Rocky Mountain range. So although the disease name is Rocky Mountain spotted fever, we usually believe that it will be around this Rocky Mountain range, but that is a wrong conception. Actually, they are present from this is north, this is south, this is west and east, and this east and south, you say. East south region states are commonly presenting with this Rocky Mountain spotted fever. So you have Rocky Mountain range over here, but the disease is usually prevalent in another part of this country, that is normally in the east. This is the west part, this is north part, this is south part. So you can see east and southern region of the America, you see this Rocky Mountain spotted fever common, but the name came from the Rocky Mountain, is actually present over here. This is, you can see over here, this is the part of, this is the north, south, western part. You can see this is the Rocky Mountain range, but the disease is present in the east and southern part. So you should not confuse by the name, that they are not prevalent in the Rocky Mountain state region. They are actually prevalent in the east and southern part of the United States of America, that you have to understand. Now let's go to some of the images, then you will understand. Let's come from here, then you will come. So Rocky Mountain spotted fever is the bacterial disease that is spread through the bite of an infected tick. So we need a tick that would need to be infected with this Rickettsiae. They are intercellular pathogen. So that infected will bite us and then we'll develop the disease. Most people who get sick with Rocky Mountain spotted fever will have fever, headache and rash. Rocky Mountain spotted fever can be deadly if not treated early with right antibiotic, and that antibiotic is doxycycline. These are the rashes. You can see this is the tick. This is Rocky Mountain wooden tick, female tick. You can see over the size, and you need to identify this tick, and they will develop the rashes that mainly on the say ankle and wrist. The rashes started on the 6th day, and that will start from the ankle and wrist and then spread to the whole body. So they are from periphery to center. They start on your ankle and wrist and then spread to your trunk and then limbs and palm and sole. So these are centripetal, from periphery to center. There are centrifugal. So from center to periphery the rashes spread. That's happen in the epidemic typhus and endemic typhus. But in Rocky Mountain spotted fever you will find the rashes appear from the wrist and the ankle and then come back to your trunk. So the classical triad is fever, rash and history of tick bite. Laboratory, you can see thrombocytopenia, hyponatremia, elevated liver enzyme and indirect immunofluorescence assay that will be done to diagnose your disease. So talking about Rocky Mountain spotted fever, please don't miss this. The rash is usually absent at the onset and may not appear. So at the onset they doesn't appear. These usually antibiotic that kill most drug don't affect the Rocky Mountain spotted fever. So you need a doxycycline, other will not cause cure of this disease. There aren't any ticks on when I got home. So people actually got tick bite, but they do not, their tick will be lost most of the time. So you cannot find the tick. The rash moves centripetally and becomes hemorrhagic. So they start from the ankle and wrist and then they spread to the periphery trunk and check palm and sole. So these are the disease that is mainly have rashes in the palm and sole as well. Now coming to this centripetal rash, this is again explained. You can see from periphery, that is explained from periphery, it is from ankle and wrist to trunk. So this is from periphery to the center. If you know the physics, there is a centripetal force and centrifugal force. Centripetal is from periphery to center. So this is the word from the physics, centripetal rash. So from periphery to center the rash will spread. You can see these are the common state. This is the north, south, west and east. In eastern region the tick is dermacenter, this dog tick or wood tick. This is more prevalent states in United States of America. They are cause the rampant lead phenomena, that is pitchy formation after blood pressure, cough, inflammation that can be found. Antibiotic is doxycycline and chloramphenicol. What are the clinical presentation? They will have the tick bite, abrupt onset of symptom, that is the fever, headache, myalgia, rash. Rash appear on the 6th days, not initially. 6 days of disease. The rash appear start from this ankle and wrist. Your ankle, you see the rash started, and even they get swollen. You can see on the palm and sole they will develop this rash. There are 3 diseases, that is the Coxsackie, Rickettsia, and secondary syphilis. So there are only few diseases that can be diagnosed if you have found rash on your palm and sole. So you can see the rashes on the palm, sole, feet, as well as the ankle has gone swollen. So these are the feature of your Rocky Mountain spotted fever. You know this is Rocky Mountain range. We know that the prevalent state is eastern region. Now let's come back to our Kaplan book, and then we will revise and finish this class. So Rickettsia, the group of disease that caused by the diseases are Rocky Mountain spotted fever caused by bacteria is Rickettsiae. Rickettsiae, you know, this needs a vector, that is arthropod vector, and that is the ticks. Reservoir are ticks, dogs, and rodent. If you talk about the epidemic typhus, it is caused by Rickettsiae prowazekii, that is the human body louse. This is the human reservoir. Endemic typhus, that is the Rickettsiae typhi, that is the rat flea. Rodents are the reservoir. Scrub typhus is common in Nepal, and that is Oriental Susugam musi, that is the mite borne, and the reservoir are rodents. There is ehrlichiosis, that can be 2 each aphensis, and anaplasmis, phagocytophilium, that is the tick borne again. So Rocky Mountain spotted fever and ehrlichiosis are tick borne. Endemic typhus, epidemic. Endemic is rat flea, epidemic is human louse, scrub typhus is mite, but ehrlichiosis and Rocky Mountain, these are tick borne. So tick borne, small mammal. We will talk about this initially about Rickettsiae are aerobic gram-negative bacilli, too small to stain well on the gram stain. They are obligate intracellular parasite that we have no. They do not made their own ATP. The species of important are Rickettsiae rickettsii, Rickettsiae prowazekii, Rickettsiae typhi, Oriental Susugam. Okay, the initially caused Rickettsiae Susugam, then Ehrlichiosis species, and Coxiella burnetii. Talking about the Rickettsiae, this will cause Rocky Mountain spotted fever. So there will be this small white rodent transmission is due to Derma centaur, that is the hard ticks. Pathogenesis, they invade your endothelial cell. So they invade the endothelial cell lining of the capillaries, causing vasculitis in many organs, including brain, liver, skin, lung, kidney, and GI tract. So the main pathogenesis is when they enter inside your body, they goes to their endothelial cell and they cause the inflammation. This cause the vasculitis. The vasculitis, blood vessel is present in major organ all over the body, and they will cause inflammation of the major organ, including brain, liver, skin, lung, kidney, and GI tract, and you will have a lot of manifestation that is mainly causing the Rocky Mountain spotted fever, prevalent in the East Coast. 2 to 12 days of incubation period, the patient will present the headache, fever, malaise, myalgia, toxicity, vomiting, and confusion, but headache and fever is consistent, that is important, along with rash. Rash is important. Rash is maculopapular, that is petechial, start on the day 6 of illness, that is important. They start on the day 6. Initially you will have a fever and headache. At day 6 they will develop the fever, rash, and rash will mainly start from your ankle and wrist, that is important. So on 6th day they start on ankle and wrist, and then spread to the trunk, palm, sole, and face, that is called from periphery to central, that is the centripetal expansion of your rashes. Then ankle and wrist swelling will also occur. Diagnosis may be confused with GI symptoms, periorbital swelling, stiff neck, conjunctivitis, and arthritis. So this concomitant feature will mislead the diagnosis. You may think, okay, there is a stiff neck. You may are thinking headache, fever, stiff neck, rashes. You will say, okay, this may be meningitis, Neisseria meningitis, but you have to understand the rash appear later. In Neisseria meningitis, you do not have rash on the palm and sole. There will be no ankle swelling, so that we can differentiate clinically as well. And obviously, by doing the CSF puncture, you study the spinal fluid, and you can find there is in Neisseria there will be the organism. In this, you will go for the another way, like Wilfelix text is common. Usually done, we do not do Wilfelix text, but it is usually common in developing countries. We do for the antibody titer. I will go for the diagnosis. Like diagnosis will be the clinical symptom plus tick bite. We can start the treatment without laboratory confirmation. So you start doxycycline. There is no need of laboratory confirmation if you have a clinical high suspicion and a patient has a history of tick bite. Serological, that is indirect fluorescence assay, that is will be can done and test widely used. So the most commonly used everywhere, including United States of America, is serological, that is indirect fluorescence assay. That is important, immunofluorescence assay. Fourfold rise in titer is diagnostic. So what will be the most diagnostic? Serological IFA, that will be a diagnostic one. And if we are able to demonstrate the fourfold increase in the antibody titer, then we understand, okay, we have not diagnosis. Well-Felix test is one of the primitive tests which was actually done to diagnose this rickettsial disease, including Rocky Mountain spotted fever, and that is due to the cross reaction of Rickettsiae antigen with OX strain of the Proteus vulgaris. So actually, if you have a Rickettsiae, there will form the antibody. This antibody will react with the antigen of this Proteus vulgaris OX, that is similar of Rickettsiae, and there is, due to the cross reaction, you will found the rickettsial antibody can be demonstrated by reacting with this Proteus vulgaris OX antigen, and then there is agglutination, and you can identify and you can label as a rickettsial disease to that patient. So this is a cross reactive reaction. This Well-Felix test is used previously but not longer, now no longer used, but it still may asked on your USMLE board. So Well-Felix reaction, this cross reaction of Rickettsiae antigen with OX strain of the Proteus vulgaris. Treatment is simple, that is doxycycline. Even in children age less than 8 years, prevention is prevent the tick protection and prompt removal, doxycycline for the exposed group. So we have came to know that this is the main thing, is the reason where the patient come from, and the another thing is the clinical feature. The clinical feature is headache, fever, rash, that is microbiology rash, and we know the that it start from wrist and ankle and then spread to your body. There will be ankle and wrist swelling. The diagnosis can be clinically with tick bite. We have serological, even you don't need to diagnose if you start treatment without laboratory confirmation, because this may be a fatal. Serological diagnosis, immunofluorescence assay, and fourfold rise in the antibody titer. We can even do Well-Felix test is usually do in the primitively in underdeveloping country where there is no facility of this serological test. If you asked, they can ask about it, but usually not done in at present in United States. We can go for actually molecular test as well. You know the pathogenesis, they invade the endothelial cell lining capillaries, causing vasculitis in many organs, including brain, liver, skin, lung, kidney, and GI tract. That is important. They are coming from the patient will come from the east coast region of your United States. I have shown you the figure. This is the east coast region of your United States. Now let's come back and revise finally. We are talking about rickettsial disease, that is a vector-borne disease. This is obligate intracellular parasite. They depend on our ATP to survive. So they cannot transmit by their own. They need a vector. So this disease, Rocky Mountain spotted fever, caused by Rickettsiae, and the vector is tick. Despite its name, its disease primarily occurs in the South Atlantic space, especially North Carolina. We are clear about that. Rash typically start from the wrist and ankle. We are also clear, and spread through the trunk, palm, and sole. This is called centripetal spread. We have clear about this. The classical triad we need to for diagnosis: headache, fever, rash, including tick bite. So there is a tick bite with headache, fever, and rash. You have to understood we are talking about this rickettsial disease. The remembering formula was there are 3 diseases that cause rash on the palm and sole. That is the palm and sole rash is taken in Coxsackie infection, that is called hand, foot, and mouth disease. Then Rocky Mountain spotted fever, that is R, and